Hey, it's Dr. Bonds. I was just thinking, you go to the doctor, it could be any doctor, it could be any specialty, maybe even your primary care doctor, and you go in there and it's like the waiting room is full, nobody looks at you, you barely get eye contact, you are told to pay a copay like immediately, just right off the bat. And then, you go in and you wait in an exam room and it takes forever. And then finally someone comes in, but they're very, very harried and very, I don't know, just frazzled, right? This person could be the doctor, it could be a nurse, it could be a nurse practitioner, it could be a PA, whatever. And they barely look at you, they ask you the same question like maybe 2 times just because they didn't listen the first time you said something. And then they just kind of spit out a quick fix, whatever that might be. And you're sent on your way, as quick as possible. Although, it's kind of like as quick as possible for them just because they're busy. That health provider or that health care practitioner is, swamped, right? And when you're sitting there, you just like kind of get nervous, like, oh my gosh, I know they need to go. I don't want to bother this person. I don't want to be a pain or a burden. I don't want to keep them longer. I know they'll just be, running later for the next patients. And, you get so frustrated. You might even like forget like what questions you wanted to ask. You walked in there and you knew exactly what was going on or what you wanted to ask and what you were trying to find the answers to. And then when you get there, you're trying not to be a burden. You're trying not to be annoying. You're trying to be as concise as possible. Like try to go for only the things that matter the most without saying anything that could be superfluous in any way, right? Because you're trying to save that person time. You're just trying to be nice to them. Meanwhile, that practitioner is doing their best inside this incredibly tight time constraint because they have 20 other people lined up waiting, and maybe 20 other charts. They need to sit and document everything that they've done with all of these patients. And maybe they're seeing like 60 patients a day or some crazy number, maybe more, I don't know. And I was just thinking, it's just a messed up healthcare system, it's just messed up, healthcare, we're supposed to be caring for each other. I'm an optometrist. I did this to take care of people, and to think that any healthcare provider should be so swamped with patients, forced maybe to take on a patient load where a person who is seeking help can barely even get a few words out, let alone the whole story of what's going on with them. And for the practitioner to really listen and take in all of the information for that person, it's impossible and it's not fair and I don't like it. And, as an eye doctor, I'm trying to do my best to break that system or break out of that system in my own practice. I want to give people time. I want to take my time so I can really, take into account all of the details and then figure out what we need to do from there. And that's the way I think healthcare is supposed to work. It's supposed to be one person using a breadth of knowledge and experience in healthcare to help the other person who is the patient and to care for them. Healthcare doesn't feel like care anymore. I don't know. I think the system is not quite right. So I try to be different. I hope you like it. Thanks.